We're going to talk to you guys about Seb. We should actually say Seba, because Seba is from China and that's how they say his name over there. Seba is actually a husky, which sounds a little weird for a dog coming from China, but still, he's from China. Now, how do we end up talking about a dog that is from China? That's a long story. But in a nutshell, we're part of a group at the Bone and Joint Center that developed joint replacement implants. And it so happened that Seb had an injury to his knee that required our attention. The particular injury was kind of difficult to understand. Actually, a surgeon tried 2 or 3 surgeries to improve the knee function without any success. And by the time the owner found us, it had been 3 months since Seb had used his leg. He had severe muscle atrophy and barely any range of motion in the joint. After a long discussion, the owner and I decided that yes, we could do something about it. And he sent the case over to us. And after a long flight, Seb was in our hands and we started working with him. The first step for us was to get a better understanding of what the problem was with his leg. We obtained something called a CT scan, which is essentially a fancy way of taking radiographs, and used that CT scan to create a bone model of his own leg. And from that model, we were able to create a surgery to correct the deformity that he had sustained. The surgery was not going to be easy, and we teamed up with 2 surgeons, myself, Dr. Guiot, the other better part of the Bone and Joint Center, and Dr. Marcelin Little from UC Davis, who also has extensive experience in joint replacement. We ended up performing a very long surgery. It was about 3 or 4 hours to correct the knee and the femur that had a deformity. The outcome was extremely good. We were so pleased with the radiograph. We were not sure how the functional outcome was going to be because Seb was and it still is, a very, very active dog, running and jumping and definitely in the need of 4 legs. It was our great pleasure to see him using his leg for the first time in 4 months, 2 days after the surgery. He started bearing weight, and we were at the time very scared that he would be overdoing it and potentially create problem with the implant. So we kept him quiet with us for a couple of weeks. The owner took it home locally, and after 2 months, he was always weight bearing with the leg and minimal lameness. The recovery was going very well until someday where the owner called me in emergency because he had a problem with the leg again. We found out as soon as they arrived in the emergency room that the problem was actually with the other leg. And unfortunately, Seb had developed a problem in his opposite knee, so that was a good thing we were able to save the first one. The second knee was easy to fix, and he was on his way for recovery within a few weeks. And last week we saw him for his first 6 months recheck. He has full range of motion, no lameness whatsoever, and radiograph shows that the implants are fully integrated. So far, Seb is one of our biggest success stories when it comes to joint replacement.